Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
Disclosures for this podcast are listed on the podcast page. An oncologist recently described that while sitting on a couch to write an article, by the time he finished his first paragraph, he received 6 notifications on his iPhone from WhatsApp, Twitter, and other messages. He knows what the dilemma is. You can shut down your phone, but you become worried about missing an urgent call or important update. The oncologists know that social media is a place to follow friends and colleagues, to discover new presentations, and even debate about them. However, he understands the overload of information that is part of the rapidly evolving field of oncology. On any given day or week, there are research advances and updates in the management of cancer being shared through journal publications, conference presentations, newsletters, social media, and other methods. How does one keep up to date with these advances in oncology? I'm Dr. Adriana Alvarez, a medical oncologist at Cleveland Clinic in Ohio. In this ASCO Education Podcast, we will examine what various oncology professionals at different stages in their career and working in different practice settings, namely academic versus community and urban versus rural, are doing to manage the large amount of information influx regarding advances in oncology. Joining me are Dr. Sharad Goyal, a professor and division chief of radiation oncology at George Washington University in Washington, D.C., Dr. Shruti Patel, an oncology fellow at Stanford University, and Dr. Banu Symington, a medical oncologist at Memorial Hospital of Sweetwater County in Wyoming, an adjunct professor in the University of Utah College of Nursing. Let's start. One of the first questions I have here is how you can describe your current field of focus in oncology. Dr. Patel?
My current clinical focus in oncology is in thoracic and gastrointestinal malignancies, while my research interests include clinical trials, liquid biopsy, and diversity, equity, and inclusion.
My current clinical and research focus is on breast cancer radiation therapy, as well as radiation therapy with respect to neuro-oncology in the neuro-oncology space.
What about you, Dr. Symington?
I'm a general oncologist, medical oncologist in an extreme rural. I'm considered a frontier practice. I have a special interest in eliminating the social disparity that is represented by rurality. And I'm interested in clinical trials. We are the only Wyoming cancer center that opened clinical trials.
Well, it's all wonderful to hear about you and know a little bit about your focus of work is, and we come from a variety of backgrounds. How do you feel like you keep up to date with the clinical practice, the research parts with the new drugs approval in oncology? You are still in training, Dr. Patel. How do you do that?
As a millennial, it may come as no surprise that I primarily stay up to date on clinical practice guidelines via Twitter on my phone. I find Twitter to be the best place to learn new information, just because you don't just get information about the new approvals, but typically experts in the field will weigh in on the trial design, their thoughts on whether it truly will replace the current standard of care or what situations they might use the new approval for, which can really be helpful, especially as a fellow in training. It's helpful context beyond just the information that you get from the approval itself. And then I also learn about the applications of these new guidelines in the clinic with my mentors, because I am, of course, lucky enough to still be in training where I can gather that information from my attendings.
Dr. Goyal, what's your preferred method of keeping up to date and learning more about the new treatments and research in your area of interest?
As opposed to Dr. Patel, I am not part of social media in medicine. Actually, I'm not a part of any social media, whether it's personal or work related. So I tend to be a little more, quote unquote, old school with respect to how I ingest information. So in terms of clinical practice guidelines and new drug approvals, which is somewhat peripheral to my field in radiation oncology, I tend to rely on NCCN guidelines and attendance at tumor boards to receive that information from my colleagues in medical oncology. I believe that with any patient that I see with a malignancy, I do tend to refer to the NCCN guidelines on a regular basis. And if it's a malignancy that I do not see, I have to reference PubMed, UpToDate, and the NCCN guidelines to determine the best course of treatment for that patient.
What about you, Dr. Symington? Being in the rural areas, I can see that you have a variety of patients, a variety of situations. How do you keep up to date?
I guess I'm midway between Drs. Patel and Goyal. I do not follow Twitter, but I belong to a 5,000 member online hematology oncology support group. And we post questions and local thought leaders will reply. I am in such an isolated location, I don't get the stimulation or the benefit of walking down the hall to a colleague to say, what would you do? So I am affiliated with the Huntsman and the University of Utah. I've made an effort to join every organ-specific tumor board so that I can hear discussion by disease thought leaders about how they're going to take care of each type of cancer. And hearing that week after week, I do absorb it. Medical oncology, it's a challenging field because things move so rapidly. I took an 18-month sabbatical, mostly sabbatical as I functioned as a chief of staff at a larger hospital. And in that 18-month period where I volunteered in a clinic, immune checkpoint therapy arose and targeted therapies for lung cancer arose. And I felt like Sleeping Beauty. I went to sleep in one world and I woke up in a completely different world of oncology. And it was hard to get back into the drift until I connected with colleagues. I'm an avid reader. I don't sleep much. So I am a member of AMA, ASCO, and ACP. So I get all the print journals. And I have a disorder, an obsessive compulsive disorder that makes me have to look through every single journal I get. So print and tumor boards and colleagues.
So we are very busy in the work that we do, the clinical work, trying to keep up to date and, training and all that. How do you schedule time to do this, to learn about the research advances and to keep going? Dr. Goyal, how do you find the time?
In general, I do think that in my realm, in my head, I think that there are three processes that have to occur when I incorporate research into my practice. So number one, I have to learn about it. Number two, I have to determine if that's going to help change my practice. And then number three, if I do end up changing practice, I have to implement it. And that involves dealing with my staff. So I'm going to delve into each of those in a little bit more detail. So learning about the advance, typically I learn about things through CME activities. So in one of my roles in our cancer center, I help organize our grand rounds and some oncology specific courses. Being involved in the organization, helping find speakers really keeps me engaged, not only in the organization process, but also in the learning process, because I have a vested interest in making sure that the trainees and other faculty that attend my courses are learning and are happy.
To organize all this, do you schedule time during your job, outside work hours?
Yes, that is part of my job, which extends outside of work hours.
Sounds good. Dr. Symington, well, you mentioned that you don't sleep much, you keep up to date, looks more at night, but do you find the time, in between patients or during your work day to keep up to date, or is more like a solitude type of time?
I forgot to mention a resource that I feel like people should know about, MedNet, which is presented daily with 3 clinical cases and thought leaders mentioning what they would do. They often introduce research ideas that are not adopted into practice. Since I read about new innovative treatments, but I am not an early adopter. So I wait until they become an NCCN guideline before I would adopt it. So that might be different from Dr. Goyal, who's in an academic center. But I see patients 5 days a week, 10 hours a day. So it has to be all scheduled outside of those hours. It's fortunate that my kids are grown and I don't sleep much.
What about you, Dr. Patel? On the go, I can imagine. I remember not long ago being a fellow and a millennial, so I guess, on your iPhone.
Even though I'm a fellow, I do like sleep. And now that I'm in my research years, I actually get sleep, which is lovely. And so I can't say that I schedule time to learn about research advances, but rather it's usually I take the train to work. And so I'm scrolling on my Twitter on the Caltrain down to Palo Alto, monitoring for medical news or updates. Really, that's how I gather information. I also partake in CME activity, creating CME educational materials on Twitter as well. And so that's another way in which I learn, because if I'm creating the information, then I have to go through the trials and go through all of these things, side effects. And so it's a really great way additionally for me to learn. But none of that stuff is really scheduled. It's kind of really when I have time or, on my to-do list, usually outside of business hours. It's part of the job is staying up to date with things outside of business hours. And I think we all knew that when we signed up for the job. And it's only gotten more as all of these advances are kind of coming at us like drinking out of a fire hydrant.
The most recent moment that you found new information related to your practice, how do you learn about it? Not about everything that you do, but the last time, the most recent one that you did that. Dr. Goyal?
I recently referenced the NCCN guidelines. I was treating a gentleman with male breast cancer, and he told me he had some half brothers and that they were going to get tested, but he was inquiring about the screening guidelines for men with BRCA mutations. And I had to look that up. I knew what they were for women, but I actually did not know what they were for men.
What about you, Dr. Symington?
So last Thursday morning at 7, I joined the Huntsman Tumor Board for breast. And one of the breast-specific oncologists actually said something that defies the NCCN guidelines, but it sounded like it made sense. He said he regularly gets PET scans for staging lymph node positive, HER2 positive breast cancer, because he finds, and apparently the breast cancer community finds, that other scans can give you a false negative result. And there are enough patients with metastatic disease in the lymph node positive setting that he recommended PET scans for staging of HER2 positive breast cancer patients, but not for ER positive breast cancer patients. So that was just 5 days ago.
Wow. And what about you, Dr. Patel? When was the most recent time that you find something that was good information for your practice?
Yeah. As a fellow, I love learning about new information when I'm able to learn how to integrate it into the practice with someone that's more experienced than I am. So, of course, I've already mentioned that Twitter can be a great place, but also a few weeks ago, I was attending GI ASCO up in San Francisco, and they presented the latest results from Napoli 3, which was a phase 3 study looking at first-line liposomal irinotecan, 5-FU, and oxaliplatin versus gemabraxane. And they presented that it was shown to improve overall survival compared to gemabraxane and first-line metastatic pancreatic cancer. And I was actually sitting next to my clinic mentor at the time. And during the break, I got to hear about his thoughts on whether this is going to be integrated into clinical practice, given that the control arm was gemabraxane and not FOLFOXIRI. And we ended up discussing it again during our weekly GI trials meetings, just when we're thinking about opening new trials and what the control arm should be. And so I just thought that was like a new piece of information, thought about it in the clinic, thought about it in the trial meeting, and it was pretty cool.
Great. So different settings, different ways to gain information. So Dr. Symington, you have to see a little bit of everything. So you have to be an expert in everything. And I wonder how you, Dr. Goyal and Dr. Patel, that you are kind of more subspecialized. How do you usually follow advances in other cancers that are not in your particular area of interest, or just focus on your disease group? I'm going to let Dr. Goyal go first.
Thank you. So I find that I tend to go to conferences to learn about advances outside of my disease focus. I prefer going to the educational sessions at major conferences like ASTRO or ASCO to keep up on things. On a more local level, I do find when I cover tumor boards for my colleagues that I do have to prep their patients and learn about different treatment paradigms within those disease sites. And in doing so, I feel like I'm able to gain a deeper understanding about oncology in general. And I do very much appreciate that.
And Dr. Patel, well, you're in training, so you have to see a little bit of everything, even though you have the focus of your specialty that you are looking forward to do. But do you follow those two as well? Other areas that might not pick your interest right away, but you want to be updated?
That's exactly it. I have to have like a working knowledge of all the areas of oncology that are not my focus area. But really, for the most up-to-date information, the reality is that there's so many new advances in all of these disease types that I find myself leaning on my colleagues. If I come across a lymphoma patient on consults, I'll usually reach out to my lymphoma specialized colleagues, whether that's my co-fellows or attendings, just to kind of run the patient by them, get their insight, get their input, because they're just a lot more up to date on those things than I am. But really, regardless of the subspecialty within oncology, I do think that understanding the basics of all the oncology subspecialties is important in medical oncology, because most of us will for me, because I'm a fellow, will be spending time on the inpatient service, which is not tumor type specific. And you really do have to make decisions for patients. And while, of course, you always have your colleagues to rely on and call on, some of those decisions are being made in the middle of the night. And so having a working knowledge of all of them, I think, is important.
We're lucky to live in a time that we have so many options, right? As a practicing oncologist myself, I rely also on all the resources that you're mentioning. The fear I have sometimes is, okay, I'm relying on the NCC guidelines, but what if I'm missing something? The fear of missing something, right? It's like, if I'm not in Twitter or in another social media, I'm missing the most recent data that may affect my patient care or, things like that. But if I have to ask one of you, if you have to pick one, what could be your preferred method or format of receiving updated information? If you have to decide where you could go for. So what about you, Dr. Symington?
So although I have made the case that I love reading, I actually absorb information better if someone is talking to me. So if I had the freedom to take time off, I would prefer to hear it at one-day specialty seminars where a thought leader is describing their work. That is not what I do in practice, but that would be my preferred way of getting new information.
Dr. Goyal?
I'm very much aligned with Dr. Symington in that I prefer a less active role in the learning process, and I prefer to be spoken to. My preferred method is via podcast, but I also do prefer the in-person or virtual learning through a conference as well.
What about you, Dr. Patel?
I promise you that Elon Musk is not paying me to say all of this, because I've probably mentioned Twitter in every single answer, but my preferred method, as you guys probably can guess, is Twitter. It doesn't require too much dedicated time. Information's delivered in small doses. Like I said, I do it on my commute, so it makes me feel like my commute is actually like part of my work, which is just wonderful. I do like to attend these smaller meetings to be kind of like both Dr. Symington and Dr. Goyal said, be spoken to and really learn additional information. I would say that I don't necessarily always get that experience at the bigger meetings where the focus is more networking, but, Best of ASCO, those are kind of some types of meetings where the information is kind of told to you. It's distilled down into bite-sized pieces and really understandable.
Well, all amazing, experiences. And I'm glad that we have different point of view, in different settings, different career paths. Someone mentioned before is that we're always learning. I feel like here everybody's very humble to recognize that we're on a learning curve all the time and that we have a really interest in our patient care, because we are trying to catch the moment, try to make sure that we deliver the best care to our patient, like keeping up to date and listening to the new information. And Dr. Goyal, any advice for your colleagues in terms of how to best keep up to date?
My personal philosophy is that as a physician, the learning never stops. And if you do stop learning, maybe you should find a different field. During the pandemic, I started scheduling time with colleagues, friends in my field, and I would set up a meeting with them via our assistants every 2 or 3 months. And we would, not only socialize, but we would kind of catch up on the current state of affairs in our field. And it was an opportunity to also network. And it was very helpful, especially during COVID. It really helped me gain some normalcy and kind of keep me attached to the field of radiation oncology during that time.
How do you navigate clinic work, keeping up to date, and work-life balance? Dr. Goyal?
Like Dr. Symington, I probably work about 50 hours a week in the office. So I tend to work from 7 to 5, and I'm out of the office at 5 o'clock on the dot. I have 2 small children at home, and I want to see them at least for 2 hours in the evening before they go to bed. As a radiation oncologist, we take home call, and there are very few emergencies. So I have the weekends to not only spend time with my family, but also catch up on any work that needs to be done.
I'm so glad to hear that. Congratulations, your family. Dr. Symington?
Well, I rescue small dogs. So at the moment, I have 5 small dogs, and they get a walk a day when weather permits. We're in the middle of a blizzard in Wyoming, so weather hasn't been permitting for the past 4 days. So the love and attention of those dogs keeps me grounded. I also regularly go to the gym. I dread it every time I go, but I go at least 4 times a week, and I leave the gym and leave some of my problems behind. When I was younger, people would comment on the fact that I was slender and didn't need to go to the gym and would ask me why I did it. And I would say, it's so I don't beat my children. That was obviously a joke, but I could shed the problems of the day by running on the treadmill or using the Stairmaster. So I guess that's how I keep work-life balance.
What about you, Dr. Patel?
I would say that my work-life balance has improved greatly in the last 8 months since I started the research portion of my fellowship. I'm not writing papers at 2 a.m. anymore. So that's like a huge upgrade. But really, I think prioritizing when you're at work, but then when you're at home, really trying to prioritize the things that are important to you. I am currently in my parents' home, and while I'm recording this podcast, I get to spend time with them. I get to spend time with my family, my friends. I like to make time for those things because they provide me joy. I think a huge part of our work is being there for people in really, really, really tough times in their life. And that can be extremely emotionally draining, even though it's exactly what we want to do. And I think making sure that you have things outside of work that really provide you a lot of joy is extremely important. And so I think now that I have the time to do it, I really am trying to capitalize on it.
Well, I really want to thank you, all of you, Dr. Goyal, Dr. Patel, and Dr. Symington, for a lively discussion. I learned a lot from you and a little bit about your personal life. Thank you for sharing that and sharing how you navigate to be a physician in oncology. So this ASCO Education Podcast is where we explore topic ranges from implementing new cancer treatments and improving patient care to oncology well-being and professional development. If you have an idea for a topic or guest you would like to see on the show, please email us at education@asco.org to stay up to date with the latest episodes and explore other educational content. Visit education.asco.org. Thank you very much.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.